Well, I'd have to go back to when it started, 20 years ago. I think it was an opportunity for us to share our gifts with other people.
Well, I look at it as everybody helping everybody. I mean, it's an employee fund where we as employees, I say, give back to those who are in need.
Well, over the years, what I've seen is that the focus has totally changed. We are so in tune now to helping our employees and helping our patients, and that's what it's all about.
I know that there's something at Lexington Medical Center that's in place that's there to support them.
One of the more important things for me was the project prescription, or being able to provide medications for some of our elderly clients that don't have any money. They have to choose between food and medications.
I just want a way to give back to my community, and by working in this hospital, I have a family environment. I know a lot of people in the community because of being an employee at Lexington Medical Center, and that's my way of giving back.
Unfortunately, in order to be a recipient, something would have had to happen in your life, and it's not necessarily a good thing. Brandon was only here 20 years, 2 weeks, and 1 day. But he had a giving spirit. He had an opportunity to work at Lexington Medical Center for a little over 7 weeks when he had his accident, and a really special young man I love and I miss with all my heart. So I will not allow his memory to just go. We started off with a school supply drive for Seven Oaks Elementary School and wanted to do something a little bit bigger, so I went to the Richland County Public Library and pledged $18,000. And the first year we raised the $18,000. Being with the UEF and seeing how you give and how people receive it, and how the feeling that I have just giving and being a part and turning the numbers over to see how much money that the employees have given, I felt like I wanted that for Brandon. I wanted that for Brandon, but I also wanted to do something that made a difference.
It makes me feel good when someone stands up and says what a difference the UEF has made in their lives, both personally and through family crisis. You just know that you've done the right thing.
We had an experience with a younger girl who was experiencing breast cancer, and she could not afford to come for her treatment. She had a job, although it was part-time, and I called the foundation and I'm like, can we help her get to treatment? Nobody's promised tomorrow. We know that some cancers come to us that aren't curable. But when you know that there is a chance, as the statistics say, you're curable, you don't want to take any of that away from anybody. And if them not being able to get to treatment is the only reason, then you look for ways to help.
A fellow employee had a house fire and basically lost everything, and had some young children, and obviously both incomes were affected by having to be out of work or move to be with relatives and things. And I know that the UEF Fund benefited that family to help them get back on their feet, or to maybe secure some temporary housing at that time for them, and to help their kids with basic needs.
I think anytime you help somebody, then you see that as a reward. When you hear those stories of people who are encouraged during a time of disaster on something that hit their family that they weren't able to handle, and you hear that, and to know that you were part of that is always encouraging.
UEF contributes to the Partners Program, and it's definitely worthwhile. I think for our community it's very valuable for the high school age, or for any of those young people who may be thinking about the healthcare profession but aren't sure. I came from a very small town, very small high school, and so that was an opportunity to really enter into a bigger area When I left the Partners program, I was able to go back to my high school and say I was a part of this big organization. Well, it wasn't that big at that time, but I was a part of this reputable organization, and they made me feel like family, and they really made me feel like we'd like to see you back.
You're giving because you care. You have to care. When I support the UEF, it's because I do care.
Donating to UEF, you know that the funds will help the people that you work side by side each day. You know they're going to go to scholarships. You know that's going to go to equipment, and you know that people, your employees, have the benefit of utilizing UEF. So it's kept in house.
With national organizations, I don't necessarily know where that money is going to go, and don't have that high trust level that I have with the people that are in charge of the UEF.
For the period of time I've been at Lexington, it's grown exponentially. We've still been able to maintain that family feel, and we just take care of each other.
If you're coming here and you've been fortunate to be invited to be a part of the Lexington Medical Center family, because we are a family here, I think that the first place that you can start connecting with the family here is by supporting the UEF.
So many people are willing to give back, and just think if more were willing to give, what a big difference we could make.